Hello, I'm Dr. Stacey Naito, and I'm going to talk to you today about sequential compression devices. I'm specifically going to talk about the sequential compression device from Air Relax, and I do believe that this company does put out a product which is top-notch. So we'll get back to that in a moment. Let me talk to you about sequential compression. What is it? So it is pneumatic sequential compression. In other words, there are sleeves that are put on an extremity, either the arm or the legs. There is also a hip attachment which can be put around the waist or hips, and the bladders inside the sleeves will fill up with air. So I'm going to use my leg as an example, my leg and thigh. So when you're wearing a sleeve, you're going to feel the compression more distally. Okay, so from the ankles and then moving up closer to the heart, and this will actually mimic natural lymphatic drainage. So we're trying to get lymph to return back along the lymphatic system. What are the benefits of sequential compression? Well, we've got two different types of patients that we can look at. So let's look at the two types of people who can benefit from sequential compression. Now, the first type of patient that I'm going to talk about is someone who's bedridden or bedbound. Now, that could be a patient that we see maybe at home who is in hospice, someone who's elderly, someone who is very ill. So we will see that in a home setting. We may see that in the hospital setting. We also will find patients who are post-surgery who are at risk of developing deep venous thrombosis or DVT. Sequential compression devices are fantastic for enhancing circulation, enhancing lymphatic drainage, and also for massaging the muscles. It actually has a very pleasant effect. It really feels good on the muscles. So all of these things combined can promote recovery in a patient and prevent progression of DVT or development of DVT. The second type of person who can benefit greatly from sequential compression is an athlete. So we can be talking about weekend warriors all the way to an elite Olympic athlete. As an athlete myself, I'm an IFBB bikini pro and I train 5 to 6 days a week, and as someone who's almost 51 years old, that's no easy task. And I also do aerial arts 3 to 4 days a week. So I'm constantly pummeling my body. And I know that when I do use the leg sleeves from Air Relax, I do find great relief. I am not as sore. I actually recover faster than when I don't use the sleeves. And there are times that I won't use the sleeves. I'm traveling or I'm busy, whatever. In fact, I just got back from a trip to Utah. I was there for 2 weeks and I didn't use the sleeves at all, and I was really aching. So it's also excellent for the joints. It feels fantastic, as I said before. So what I'm going to do is I'm going to show you the product here, the Air Relax product. I really like the Air Relax brand because it is accessible, it's affordable. You're talking about spending less than $400 for the device. So you're talking about the compressor and you're talking about the standard leg sleeves, which will fit someone up to, I believe, 6'1". So that's not a big investment, and I will say that one of the major competitors charges almost $1,500 for the same exact thing. So go figure. This is also a Class 2 medical device. It will inflate to pressures over 200 millimeters of mercury, which is significant. So if you're into the science end of things, there are definitely some white papers out there that you can read which will talk about that. So I'm going to show you this device, and then I'm actually going to turn it on and show you a little demo. Okay, so here is the Air Relax sequential compression delivery system. This is the compressor here. Okay, and then I'm going to turn it on. It's going to be kind of loud here. But you can see the display here. This diagram actually shows which bladders are inflating. Okay, I'm going to turn this off for a second here. So we have the leg sleeves right and the left. I'll show you how those go on. You can actually unzip them if need be. I'm slender enough where I can actually slip into and out of these post-treatment as well without having to unzip or remove the Velcro. So I'm actually going to put these on and I will return. Okay guys, so I'm all plugged in. Basically I just slip the sleeves on, see? Slip them on. Make sure the Velcro is fastened because the sleeves will pop off if the Velcro isn't fastened. So I'm plugged in here, and then I'm just going to turn this on, and then I'm going to go with an auto program. Now there are 3 modes with this device. So there are 3 modes that you will see on this device. A mode is one in which the feet will inflate, then deflate. The calves will inflate, then deflate. The knees will inflate, then deflate. And then the thighs will inflate and then deflate. B mode is one in which the feet will inflate, they will stay inflated, then the next segment will inflate, stay inflated. The knees will inflate, stay inflated, and then the thighs will inflate and stay inflated, and then everything will release. C mode is one in which all the bladders inflate all at once, and they remain inflated for about, I'm guessing about 50 seconds, something like that. It's pretty intense. So, what does this feel like? It's a very strong squeezing motion because you have the air, the pneumatic compression actually squeezing against your extremities and promoting that lymphatic drainage and promoting circulation. I am going to tell you right now that there are times when this will not feel so good. It can be rather intense. I tend to like deep tissue massage, so I actually welcome the pain. I also take this as a good trigger because pain is a wonderful signal that we have developed as human beings. So pain tells us that there's something wrong. So if there's an area that hurts on me and I put the sleeves on and it's intensified, that's telling me, okay, I probably have a strain pattern that I need to examine. I probably need to stretch that out a little bit more. So I take those cues very, very seriously, and I think it's important for people to do so as well. So there are shiatsu inserts which you can also use. I have not put them in. They actually are pretty intense, but I do use them when my feet are hurting. So I use the leg sleeves regularly. I will use the arm sleeve on occasion. I will caution you to use the lowest setting. And as far as the hip and waist sleeve, I don't really use it because I think I'm too tiny. I just don't get anything. It just doesn't compress enough. I'm a size 0 and it just doesn't do anything for me. But for someone who is a little bit larger, I think it could work very, very well. Now, my advice is to just go on automatic here. Just use the automatic program. It's a 15-minute cycle. It's very effective. You don't have to muss or fuss or decide on which mode to use and all that, because all 3 modes are actually included in the automatic cycle. And also the program here will sense whether you have the arm sleeve, the hip sleeve, or the leg sleeves plugged in here. So for those of you who are very tall, like over 6'1", there is an actual longer sleeve that you can get, and you can get sleeve extenders. So for people who are more heavy set, you can actually use the sleeves with the extenders and get a really nice effect. So definitely recommend this product. I definitely recommend this brand. So check out the link at the end of this video to order a compression device from Aerolax. And last but not least, please subscribe to my YouTube channel, and please also check out my newly revamped website at www.staceynaito.com. I'm going to sit back and enjoy the rest of this treatment.